Recording a 12-lead electrocardiogram, verified the doctor's order, assessed client's knowledge regarding the procedure, obtained baseline vital signs. Respiratory rate equals 20, heart rate equals 96, oxygen saturation equals 100%, body temperature equals 36.6 degrees Celsius, blood pressure equals 120 over 80 millimeters of mercury. Obtained previous ECG tracings, gathered and prepared the appropriate equipment, performed hand hygiene and dons non-sterile gloves, worn gloves if needed. Confirmed the patient's identity using at least 2 patient identifiers, checked ID and asked full name. Provided privacy by closing the door to the patient's room and/or drawing the curtains surrounding the patient's bed. Introduced self and explained the procedure to the patient. Placed patient in supine in the center of the bed with his/her arms at sides. Raised the head of the bed if the patient desires. Ensured that the patient's arms and legs remain relaxed. Expose the patient's arms, legs, and chest, and then cover appropriately with a bath blanket or sheet. Selected the electrode sites. Clipped the hair using hair clippers, if an area is excessively hairy. Washed the electrode sites with soap and water, and then wiped with a washcloth or gauze pad. Applied disposable pre-gelled electrodes to the patient's wrists and to the medial aspects of his ankles. Positioned disposable electrodes on the patient's legs with the lead connections pointing superiorly. Applied a pre-gelled electrode at each electrode position on the patient's chest. Connected the lead wires to the electrodes. Asked the patient to relax and to breathe normally. Pressed the auto or start button. Observed the tracing quality. Removed the electrodes and cleaned the patient's skin with tissue. Removed and discarded gloves if worn. Performed hand hygiene. Assessed client's response to procedure. Identified unexpected outcomes. Recorded pertinent data in nurse's notes. Reported any unexpected outcomes.